I was an EJP RD fellowship holder in 2021. I'm a medical doctor, and I was lucky enough to get this scholarship during my PhD. So I had the opportunity to change my home institution, which is in Hungary, Budapest, to Heidelberg for half a year and learn so many new methods. I have been working in basic research and translational research regarding a molecule called PAR7, which is a multifunctional anti-inflammatory, anti-fibrotic molecule, and we have been trying to find the role of this molecule in peritoneal dialysis and membrane changes during this treatment. I have not only learned new methods, but I have also had the opportunity to see a whole new type of thinking in this really lively scientific community, and I cannot be happy enough to be a part of it still. It was an absolute baseline for my career from that point, with fantastic people, both personally and scientifically, and I also am lucky enough to call some of them a friend still. We still maintain a really active relationship between the two institutions, so we work a lot on common projects together since the scholarship, and it has helped to widen my perspectives as a medical doctor and also as a researcher.
For a small and distributed community as the one around the GNR1 gene mutation, networking and knowledge sharing between clinicians, researchers and families are essential. Thanks to the support of the European Joint Programme on Rare Diseases, in June 2023 we organized in Rome a 2-day conference entirely dedicated to the GNR1 gene mutation, with around 200 attendees from several European countries as well as the United States. It was a very special event where everyone shared the same objective: join forces to improve the quality of life of the patients and find an effective treatment. We are very thankful to the European Joint Programme on Rare Diseases for making it possible.
Working on both the verification stewards and onboarding teams gave me a perspective on what a resource goes through to join this network of EJP RD. And on the other hand, we also see the infrastructure that we need to have in place for welcoming them. I think that EJP RD is crucial because it builds the infrastructure that integrates all these tools and resources for rare disease research. And you can imagine as creating a virtual space where researchers can collaborate more efficiently, thanks to, of course, these standards and protocols that we put in the background. EJP RD also promotes data visiting, avoids duplication, and fosters a collaborative culture through conferences, trainings, and workshops. We actually work together with our community in many of these interactions. In essence, it's like a driving force behind bringing researchers, tools, and data together to advance the research on a rare disease in a collective manner.
My research seeks to improve the lives of patients with a rare autoimmune disorder, ANCA-associated vasculitis. And we were awarded an EJP grant called FAIRVASC. We developed new technologies to link data from diverse registries across Europe. Using a semantic web approach, the FAIRVASC partners were able to create a single portal that for the first time allows exploration of over 5,000 patients with this disease, an unprecedented number. And as the project name suggests, this data is now findable, so it can be found on the web if you search for it. It's accessible, we can give access to people to it through this single portal. It's interoperable, which means that other people around the world can use the same schemas to link with our data. And it's reusable, means that it can be reused again and again by researchers around the world, thus aligning with the EJP vision of making rare disease data fair.
Well, it has been a very pleasant and very fruitful collaboration. We regularly meet online, especially in COVID times, obviously. We had a few in-person meetings where all the collaborators come together, including all the students that work on the disorders, and including also the patient organization. And I think, obviously, it has been great to work together, exchange compounds, models together, but also for the students, I think they have been trained not only on their own project, but they have been exposed to all the different techniques that the other collaborators use. They did exchanges between labs, so we learned different techniques. Besides the project that we work on now, I think the collaboration has led to different ideas, new ideas, and setting up new collaborations or collaborative projects within the consortium. So I think it has been a great experience until now, and we're very looking forward to the next year of working together.
It was a great privilege for me to be a part of the training project for patient representatives and patient advocates on leadership and communication skills, which was held in Gdansk, Poland. It was organized by European Joint Program Rare Diseases. It was great to be a part of it because I had the chance of meeting many academicians who are specialized on leadership and communication skills. I was very welcomed, friendly welcomed, compassionately welcomed by the organizers. And I had the chance of meeting with the patient organizations from all over Europe, which I found it amazing because we exchanged ideas, we made collaborations, we made friendships. The content of the training was satisfactory and it was very useful. So when I returned back to my country, I applied all what I gained from the training to my patient organization, and it was very useful. I would like to thank to European Joint Program Rare Diseases for this great opportunity.
The EJP RD has been an asset for the progeromics network research in Hutchinson-Gilford progeria syndrome, an ultra-rare disease with no current cure. The patients age very rapidly and die at around 14 years of age, mainly because of myocardial infarction, heart failure, or stroke. Importantly, with the help of experts mentors from the EJP RD program, we have devised a data management plan to ensure open access to all the data generated in the project to facilitate clinical translation with the goal of improving personalized medicine for progeria patients.
It's very important to have a chance to really illustrate how important EJP-RD impacted the national level. I would say that there are three layers. The first layer is that in some of the European countries that even geographically are more, let's say, decentralized, it's very important to have a network that we can connect with the research. So this is the initial level that our countries can connect. The second layer is that we've seen that research for rare diseases, actually we have a lot of silos and we have a lot of fragmentation. So what was important, it was that this project brought together under one, let's say, roof, the various initiative, let's say, or innovative forces to drive the research for rare diseases for our patients, for our children forward. And that was a unique opportunity. We never had it before. It's definitely a very good start at the beginning. And we're really looking forward for the future, how this can be also accelerated. And maybe the third, more local level, I would say that when we were starting the discussion before we had the European Joint Program, nobody was interested in rare diseases. I mean, you were saying rare diseases, you didn't get a lot of replies. So having this network that we also try to push, let's say in the national levels, in Greece, I'm sure in Portugal, in Italy, in other countries, it gave us also a good reason to push and continue pushing, because you could see the levers, you could see the impact, you can see the effect that programs like that, like the European Joint Program for Rare Diseases, can bring down to the community, but also can benefit the national, let's say, the national players, the local players. And that benefit, I think, was obvious. So it was a good start, I would say. We're very looking forward for the future, because the future is it's there for us, and for the rare diseases with 95% without treatment, we own the future and we work for the future. So we're looking forward. We are sure that the next European, let's say, joint program is going to deliver even more, also at the national level, but also for us and our families that are affected by rare diseases. But thank you really so much for this opportunity.